Just a minute here. Hey everyone, and welcome to Chef AJ and Friends. I have a very special guest today, actually two guests. One is the beloved Dr. Michael Klaper, who's been on the show many times before, but he's here today in a different capacity with someone who actually was his patient during part of her treatment for lung cancer, stage 3 and then stage 4. She's actually a physician, retired now, Dr. Madeleine Long, and she is now a 10-year cancer survivor. She actually contacted me and she was so kind and she told me her story and she gave me a lot of hope and encouragement, which I need because today I start my 6 months of cancer treatment at 3 p.m. Please welcome to the show Dr. Michael Klaper and Dr. Madeleine Long, and thank you both for being here.
So wonderful to see you.
Thank you, AJ, for the invitation. It's great to be here.
Absolutely. And you guys didn't even know that, but you two match. If you would have told me, I would have worn blue. So what? So anyway, you look great. I'm so happy for you, Madeleine. And, just start by telling your story. And Dr. Klaper, if you ever want to chime in or ask any questions, please feel free to do so.
You bet.
All right. I was diagnosed in 2014 with adenocarcinoma of the lung. And initially, they thought it would be, was 1.7 centimeters. And as a result of that, they wanted to take it out and do the whole lobectomy. And that was called a VATS procedure, which is a video-assisted thoracoscopy surgery. I think that was before the time that we did robotics at our hospital. At any rate, I had that done, plenty of chest tube, plenty of hospitalization after that. But when I got out, it was fine. And then I had 4 rounds of chemo, and it was carboplatin and another agent. And the carboplatin, I complained about a hearing issue early on, and they didn't take measures to reduce the dose until later, and I lost my hearing, and so subsequent hearing aids now. And I had Avastin, and that also caused high blood pressure. And then I had to get treated for that, but that goes away. In addition to that, I had endured a peripheral neuropathy in my feet. Both feet are numb. And 40% of cancer patients will have a chemo-induced peripheral neuropathy, 40%, pretty severe neuropathy. And it gives you a little balance issues and so forth. But you kind of overcome that with a little physical therapy and a lot of exercise. So I do a lot of that. I do an hour each and every day of that exercise to keep myself going. And but after the Avastin and so forth, my numbers went up, and they gave me Keytruda. And Keytruda, for me, after the first dose, I had swollen fingers. And I asked for a reduced dose the second time around, thinking that I was small, a woman, and so forth. But the standard dose for even a 200-pound human, as opposed to a 100-pound human, is the same. It's 200 milligrams. But I think it was a little bit much for me, because the second dose, my hands and feet really blew up in a rheumatoid pattern, and my rheumatoid factor was up to a couple hundred, like 500 or 600, something like that, my rheumatoid factor, and it's not supposed to be that. At any rate, I pursued a treatment strategy that Johns Hopkins, because they did a lot of research on the Keytruda and what it causes in the rheumatology area, such as rheumatoid arthritis. So I had my rheumatoid care down there, which was exquisite, very good. I had 3 drugs treated for that, which was the steroids, the Rinvoq, and the methotrexate. And all of them are really toxic. And I was anxious to get over this. And my oncologist said, you'll never get over it, because I've had the rheumatoid now for 3 years. But Johns Hopkins had a different opinion. They said, you will get over it, and you stop all the drugs. So I did that. And luckily, I'm free from that particular element. And then I'm now on immunotherapy, as I said, 2 by mouth every day. And that has held my cancer in check. I don't know about remission, but it's just the same size as it was about a couple months ago and so forth. So it's not growing and it's not getting bigger and so forth. So Anyway, that's the story.
Okay.
I
Well,
think.
yes, that's the story, but you're focusing on the treatment. What we don't know is take us to the beginning. How were you diagnosed? We know that you were never a smoker, and that's really important because everybody always wants to know, were they a smoker? And
Yeah,
a lot of people get lung cancer that never smoked.
that's correct. Yes. And you're one, right?
Yeah. So can you tell us how yours was discovered? How old were you? Like, how
Well,
did
I was on basically then,
you
this is really kind of cute and funny, but I was on a plant-based diet and I fell in love with cabbage. Well, so I had this cabbage salad, this huge cabbage salad. And I think I was so nervous that day, I was having company and I didn't chew properly. So I wound up with abdominal pain in the emergency room with a bowel obstruction. And they took a CAT scan of my abdomen, of course, to get that diagnosed. But then they also took a picture. They caught in the picture the bottom of my right lung, and that showed the cancer. So it was an incidental finding, which I'm grateful for, of course. And I had no symptoms, no short of breath, nothing. Then I went on to treatment, my oncologist, surgery, and so forth. But I didn't expect to have the stage that I'm at because of the nodes, because my PET scan was negative. It didn't show any light up at all. And usually you go by the PET scan. So they thought I was going to be a stage 1, but I was not. It was already in the nodes.
That was right at the beginning. It was already in the nodes.
Yes, right at the very beginning. Mm-hmm.
Wow.
Yeah. So, and no symptoms, symptoms whatsoever. So I could have been years. And then when I did go for a second opinion on the lung cancer, I was asking them, the experts, then again at Johns Hopkins, I asked them how long I've had this lesion. And they said, I've had this for 8 years. It would have been in there for 8 years by the size of it, 1.7.
1.7 is 17. Mine started at 14 and then it doubled. Wow. And I had and have with symptoms too. When did you meet Dr. Klaper?
I met Dr. Klaper when I came to True North, and he was my internist there. And yeah, so we did a 15-day water fast with his help, and worked out very well. I felt very well during the water fast, and was a wonderful environment. Of course, we had classes by Chef AJ, and that was wonderful. And of course, lectures with Dr. Klaper and Dr. Goldhammer and so forth. Yeah, it was wonderful, wonderful experience.
On your collar. Dr. Klaper, you worked for True North, I believe, for about 7 years or so?
Over 8 years.
Yeah. How many patients like Madeleine with cancer did you see there, and what did you notice about the efficacy of water fasting, or just, I'm sure in some cases, some of them might not have already been on a plant-based diet like Madeleine when they got there?
Oh, well, this case is so rich. Madeleine is so rich on so many levels, and I'm really honored that she sharing this with us now. And as she knows, all cancers are not created equal, and different cancers are going to come on differently. Madeleine, can you tell us briefly, where did you grow up, and did your family history have anything to contribute here?
Yeah, I grew up in Bethlehem, Pennsylvania, and at that time, the Bethlehem Steel was our main employer of men in the city. So my father worked at the Bethlehem Steel, and he worked in the plant. So he came home with his work clothes that were full of asbestos, and we didn't realize it at the time, of course. And when the washing machine, my mother washed them, hung them out in clothes and clothesline and so forth. And so my father developed mesothelioma from asbestos. And then my mother had adenocarcinoma of the lung. She developed that years later. She was almost in her 80s when she developed that. And he was 84, and I was 72 when I was diagnosed with lung cancer. And the radiologist actually saw the asbestos fibers in my film, which kind of nailed the diagnosis as to cause, maybe. Yeah.
You were 72 when you're diagnosed?
Yes. Mm-hmm.
So, and that was 10 years ago?
That's 10 years. Yeah.
You're 82?
And yeah.
You look amazing.
Thank you. Thank you.
Oh
Thank you.
my gosh, that's fabulous. How long were you plant-based for? And do you think that helped at all?
I went back and forth. So, I was plant-based for a long time. And I discovered that, way before I had been diagnosed with cancer. And we had a lovely group where we had potlucks and raw and so forth. So it was a wonderful time. And so now I do it partially, yes. And but life goes on. And so I'm back on my. Diet.
Uh, so I'm curious about a couple of things, but to answer your question, AJ, we had a number of cancer. No, we didn't have a lot of cancer folks come through, and a couple of them came through immediately post-operative. It's a great place to recover from surgery, and they went home. Um, we had one classic patient, Yvonne, who had a lymphoma. And she did a 22-day water fast and a really stringent diet, and the lymphoma just melted away. And she's been followed up over the years now, and it never came back. And it was written up in the British Medical Journal. But lymphomas are different than what Madeleine has here, an adenocarcinoma, which is a tougher, meatier tumor. They're full of glandular tissues, these really fibrous, tough, bony tissues. They're all different, and they're all going to respond different to a given therapy. That said, in all these tumors, you don't want to feed the cancer. You don't want to be eating a bunch of sugars and fats and oils and fried foods and just over nutrition and gorging in on Oreo cookies, even if they're vegan. You want to do the opposite. You want that food stream to be one have full of the phytonutrients from the salads and the soups and the steamed veggies and the fruits and vegetables to stabilize the tissues and give that chemical message, shh, calm down, no need to multiply wildly. And I'll ask Madeleine about her diet in a minute. Um, it says, how long was the tumor there for 8 years? Oh, it was there longer than that. Just to be seen at 14 or 12, 18 centimeter, 18 millimeters. The doubling time, if you go back, it was in the tiny pinhead stage and the micro stage years and years before that. And again, probably in your 30s or 40s after breathing those asbestos fibers, some finally set off malignant changes. And people who live in Los Angeles or breathe air polluted air year after year after year, they can suffer the same kind of malignant changes. But it's such a thrill to be talking to you. I remember you well now, and there we were in 2017, which is 8 years ago, and how well you look. When I was a boy in medical school in the early 60s and 70s age, and adenocarcinoma of the lung, ooh, that was a death sentence. They were all gone within 2 years or 3 years. Here you are, 10 years after diagnosis, and you look great. You work out for an hour a day, do I understand?
Yes.
You get on the treadmill and you don't get short of breath, you're not coughing.
No, no, none of that.
Oh,
No.
that's great. You're sleeping okay?
Sleeping well. Yes, very well. Yeah.
Wonderful. So take us through a typical eating day. What are you really having these days?
I'm sorry. Can you say that one more?
Take us through a typical eating day. What do you have for a day of food from morning till night?
Oh dear. A lot of grains. I was doing sprouts for a while. It's very difficult to get here in the Northeast, the sprouts, unless you do it yourself, of course. Yeah, and sometimes I do a plant-based retreat down in Florida. I do that to keep on the diet as much as I can, but I'm not completely vegetarian at this point, so I don't want to mislead you on that. I To go through the whole day, just a lot of greens, a lot of salads, a lot of raws. I love raw, and so people that I have dinner with, they get all upset that I'm eating all raw food or, salads and so forth. They get, why can't you have this? Why can't you have that? And then I pretty much stick to that. It's not a hard thing. It's a discipline. And so we're used to that, going to medical school and doing all the residencies and stuff that we do. It's sort of built into us kind of thing. So I'm glad we can be here to support AJ in her diagnosis now and her treatment strategies and so forth, because it can be done. You will be here 10 years from now, God willing.
I hope so. So, but
Yep.
you seems very calm. Like you were never like stressed or nervous or anxious about this. Is it because what kind of doctor were you?
Internal medicine. And then we had two other partners that were women, and it was lovely. We first got, a lot of women in, and then we got the husbands, the nephews, the nieces, the whole family. We went to their bar mitzvahs, their funerals, it was wonderful. It was just a wonderful practice. Pretty much at age 12 to age 85, 95, and so forth. That was a general rule.
I would just like to point out to the viewers that Madeleine, we were reviewing her treatment regimen, and she has been on the receiving end of some very powerful, high-tech anti-cancer therapies from the high temples of oncology. And she suffered some side effects from them. And, she was certainly willing to share that. But the side effects go away. And here she is 10 years later. I'm not saying that's the only reason. I think her plant predominant diet and her positive attitude and her physical activity and her intent to just live her life has a huge amount at play, to play here. But it's not necessarily, oh, I don't want to mess with that chemotherapy. Everybody gets sick and dies early. Science has marched on, and they have very powerful medications that can do great good. They have unscrambled the DNA of her particular cancer cells and have designed therapies to particularly foil the malignant growth of her cancer cells. And here she is, 82, living her life, and she's not. She's eating, drinking, walking outside, enjoying her existence. Now, I'm curious, and I'll ask in a second about any supplements or herbal therapies or alternative therapies she might be taking. But just in general, I hear someone who received the benefits of some high power therapy and got through it, and I think is reaping the benefits. Are you taking any supplements of any kind at this time? And are you getting any alternative therapies, acupuncture, etc.?
No alternative therapy, routinely, no. And yes, supplements, multivitamins, something for my eyes like Ocuvite, and just vitamin D, a lot of that. And just that's it, basically. I don't do a whole lot of supplements, no. But one thing I want to mention, in addition to what you asked, is I was left with you mentioned side effects. I was left with a lot of pain after the thoracotomy, and it was in my back. And I went to 5 or 6 different pain specialists, and they kept giving me drugs and more drugs and more drugs. It didn't work at all. And I pursued that course and found a interventional radiologist down at the University of Pennsylvania that he did a cryoablation procedure for me. He did put a probe in my back and froze. The cancer cells were sitting on the nerve endings, causing the pain. And he ablated them at a minus 140 degrees, took the cancer away as well as the pain. So I was delighted to getting that procedure. It made my life certainly wonderful, livable again, and to take the pain away was a great relief. Yes.
Good for you, and good for the radiologist, but good for you for being persistent and making the system work for you and not taking no for an answer. And that's such a great example for how to make the medical system work for you. I'm just delighted how you look and how you're doing here. I'm reminded of a poster that I had on the wall in my dormitory room when I was in pre-medical studies at University of Illinois. And it was a picture, it was a cartoon of a bumblebee and kind of a frumpy, dumb, confused looking bumblebee looking at you. And the headlines was, "The bumblebee cannot fly." Um, Aerodynamic analysis has clearly shown that the bumblebee's weight and the bulbous shape of its body produces so much drag, and his wing area is so small that it makes flight absolutely impossible. He can't get enough lift to get off the ground. However, the bumblebee does not know this and goes ahead and flies anyway. Right, and you're kind of like that bumblebee. No matter what the prognosis numbers are and all that stuff, man, just do what you got to do, eat healthy, be happy, and get on with your life. And the body responds. Your immune system listens to that, and I think it has a great influence on your state of health now. The Dr. Colin Campbell wrote that great book, Whole, Whole. And he's saying, don't focus on the individual amount of vitamins in a rutabaga. It's the whole food stream moving through you day after day. That's the important thing. Is it healthy or not? Well, you also showed that food stream, big capital F, your thoughts, your activity, the love in your heart, all that is part of that stream that needs to move through you, that produces ultimate health there. And I think you're doing a great job of it. So keep on keeping on. You're an inspiration. It's great to see you, Madeleine. I
Yeah,
remember
thank
you
you.
well. Right.
But that's our message for AJ. I mean, we want to support you. You're not alone. That's all we can do is tell you my story, and it worked, and I know it'll work for you.
Well, thank you so much. I have more questions for you, Madeleine, but Dr. Klaper, there was a great question that just appeared in the chat from Susanna, which is, how is a person even supposed to know they have lung cancer when it's not something that's ever screened for?
Yes, welcome to the 21st century. Madeleine is a classic case, as were you, of being diagnosed by a radiologist who finds what the common lingo is in radiology circles. It's an incidentaloma, and that just happened on another unrelated X-ray or scan. Boom, it shows up there. And certainly, if you have a smoking history, if when you're in college or whatever, you were doing a pack a day, and even if you're 50, 60, whatever, you should get probably a CT scan, if not a screening X-ray, just one, and just make sure you don't have a sleeper hiding in there. Not so crazy. And if you lived in an urban area and breathing urban air for 20 years, etc., it's not, and you've got a family history of it, your brother, uncle, whatever, died of lung cancer. Yeah, it's probably worth getting a quick chest X-ray for a screen. I'm sure there's going to be future blood tests now that will pick up cancers in cells and antigens in your bloodstream. They'll probably be diagnosing it by blood tests before too long with a drop of blood, I suspect. But if there's any question, yeah, get a chest X-ray and see where you're at.
Well, the thing is they are already. I mean, I couldn't get a biopsy at first, and so I got the blood test. And mine was called True Blood, and that showed adenocarcinoma. And the thing is with the chest X-ray, I being asthmatic, I've had many chest X-rays, but my nodules never showed up because my tumor is hiding behind my heart. So if it wasn't for that incidental abdominal CT scan that just picked it up, I wouldn't have known. I wish I never knew. But then I hear these other stories, like in Madeleine's, like how it grew. Maybe it was a blessing to know.
Indeed. We'll find out.
Yeah, we'll find out. The story hasn't been written. But Madeleine, you seem so calm. I mean, this was 10 years ago, of course, but you just took it in stride being a physician, obviously you probably weren't very happy about it, I'm guessing.
Right. And then I sought help. I did. I had a psychologist. I needed help to get through, to say the least. And that was forthcoming. So I needed that. And I did a lot of mindfulness meditation. Thich Nhat Hanh's theories and so forth, I follow that. And that's helped me a lot to be calmer, to go with the flow and so forth. So that was very helpful. Mindfulness, yes.
That's fantastic. Well, Dr. Klaper, you might know this because you know a lot, just because you're a smart doctor, but also working in True North. So I still see Dr. Peter Sultana. I mean, I've always seen him since he became my doctor in 2011, but I've been seeing him every 2 weeks now virtually. And he has me fasting now because I start the treatment with Keytruda today.
Mm.
So I'm actually, I'm like I'm a lightweight when it comes to fasting. 4 days and I'm done. But so yesterday I did just green juice, 2 green juices, so probably had about 500 calories. And today just water, and I'm already like, oh, I wish, like, I feel like fasting is sometimes worse than the cancer treatment. It's so hard. And you've seen people go for 40 days.
Mhm.
Indeed, and I want to really share this with your viewers here. This is really important what AJ is doing, and she's being a good sport about it, but it's going to pay off. And the medical rationale behind the fasting before the chemo goes like this. When we stop eating our normal fuel, which is glucose containing fruits and vegetables, etc., for 48 hours, 72 hours, blood sugar levels start falling. The body starts burning fat, so ketone levels go up. IGF-1 levels go down. All sorts of chemical changes start happening that send out signals to all the cells in the body saying, uh-oh, our usual fuel is not here. We're burning fats. It's going to get a little acidic here. Blood sugar is going to go down. Everybody hunker down. Don't waste energy that you may have in your cells already. Don't run inflammation. That's a waste of energy. So inflammatory reactions are toned down. And cell division slows down, and because there's going to be more free radicals and oxidation, all the cells out there stock up your vitamin E levels and antioxidant levels, and the cells kind of hunker down and they stop multiplying, including running a cancer. That's another waste of energy. And so cancer growth slows down as these molecules called sirtuins build up in the cells. So the normal body cells are kind of hunkered down after a few days of being in ketosis in a low blood sugar state. But cancer cells can't do this. They are just dumb old cells. All they know is take in energy and divide, take in energy and divide. So they don't develop the antioxidants. They do stay in a state of rapid cell division, which is their most vulnerable state. So the good body cells become more resistant to chemotherapy, while the cancer cells are more vulnerable. And that's the time to zock them with the chemotherapy. And that's what AJ is going to be doing there. And so she's going to get more bang for the buck from the chemotherapy. And this has been shown to be a real phenomenon. This is not California woo-woo stuff. It potentiates the effects of chemotherapy. Also potentiates the effect of therapeutic radiation as well. The folks who go into radiation therapy on day 2 or 3 of a water fast get better results as well. So it's worthwhile what AJ is putting herself through right now, because her cells are going to get through the Keytruda better, and her cancer cells are going to be more vulnerable, and she's going to get a really great effect off of this. So hang in there.
Just so you know, it's just so to clarify for you in the audience, I'm not actually getting chemotherapy. I'm getting immunotherapy.
Immunotherapy.
Because yeah. No, that's okay. But how did Madeleine, Madeleine, you said you were allergic to it? Because
you mean Keytruda?
Keytruda.
I wasn't allergic to it. It has a propensity to cause another issue like rheumatoid arthritis completely. And so, my hands blew up. It would seem like an allergy if you say my hands blew up and so forth. But when they did my rheumatoid numbers, they were sky high, just sky high, sedimentation rate, rheumatoid factor, and all that.
Did that happen with the first treatment?
The first treatment, I had swollen fingers.
Oh, man.
And I showed them that, and they said, no, not to worry. We'll give you a second dose and see what happens. Well, the second dose, that was the last dose I had, because I was in full-blown rheumatoid arthritis, so I had to get help. for
Well,
that.
that's interesting to know because I mean, I just pray that doesn't happen to me because this drug was like an 85% match and I really, really want it and I want it to work. And I'm going to be getting 8 treatments over the next 6 months. So I just hope that doesn't happen to me.
Mhm.
Good
Well,
chance.
I know a lot of, we have a support group here too, a cancer support group that I started. And one of our gals is on Keytruda, and she's been on it for years. She's been doing very well, very well. So it works. It works for her. It works for other people. It just happened to be the one that it didn't.
And AJ, I suspect the fact you're going to this fasting, you're going to have a much lower chance of this thing affecting your fingers or getting that rheumatoid-like reaction, and your diet is going to be so clean afterwards.
Good. Yeah. I didn't water fast yesterday because I just felt like even doctors like this. So this is my only day of pure water yet. And I mean, it almost was like fasting. It's like having two
Really.
juices, but so somebody's asking, Faith is saying, do you have to be careful with fasting on blood thinners? I thought you couldn't fast if you were on any medication.
I don't know about that. I fast routinely on blood thinners and so forth. So I don't.
Oh, Dr. Klaper, at True North, they don't fast patients on blood thinners.
No, they usually don't. But Madeline, which blood thinner are you on?
Eliquis.
Eliquis, right. So these are much less affected by uh, vitamin K levels and blood sugar levels, et cetera. And probably with these newer anticoagulants, you can probably get away with it again for a few days. They give you a pretty steady level of anticoagulation. I don't think, these are short-term fasts we're talking about. I think it's probably safe to. I wouldn't do it on warfarin, however.
Dr. Klepper, why do they give everybody, like Madeleine was talking about the amount, they give everybody the same amount of drugs? And I said, can you give me less? I'm medically sensitive. And I mean, they don't seem to take into account how much a person weighs or anything. Everybody gets the same amount.
Of the many times I wind up apologizing for my profession, here's another one. It's embarrassing. The reason why, of course, is that the studies that they are taking their clinical guidance off of were only done at that one dosage, and that is the only dosage they could legally defend in court. This is what the researchers showed, and that it has no effect, that lowering the dose might increase the risk of it not working as well, and they just don't want to take the chance of getting sued. It's a legal cowardice, if I may be so blunt. But meanwhile, real patients suffer. That is way too much drug, apparently. Certainly was for Madeleine, and. We doctors, we adjust our dosage all the time. How many milligrams per kilogram determines, the actual dosage. It's embarrassing they don't do it for the chemo, but either the tumor went away or it didn't at this dose, and that's all all they can prove in court. So they hold on to that for dear life because their malpractice lawyer is telling them to. Not a good reason
Do
medically.
you, did you feel anything during the infusions or it just feels like getting a regular IV?
Just an IV, really. It's quite quick. It's really nothing much to worry about with the infusion itself. No problem.
Wow, that's so cool. Dr. Clapper, I haven't talked to you in a while, but I've actually had my last scan was better even before treatment because I've gone on some off-label drugs, ivermectin and menbendazole, and it started going in the right direction. So I'm going to continue that. I'm not today. I'm not taking any drugs today since I'm water fasting, but I'm going to continue that during the treatment.
Mhm.
Remarkable. Wow. Keep me posted on that. Do you take both the ivermectin and the mebendazole daily, every day?
Yeah. So here's the thing. I wasn't even on the menbendazole only because it took a while to get it because I don't want it. I'm not that person that's going to buy things illegally or whatever. I had a legitimate medical doctor prescribing these things. It took a while for the menbendazole to come because it's in compounding pharmacy in New Jersey and they had to make it. So while I was waiting, I was on ivermectin for 3 weeks, not even a full dose because it was affecting my vision. And then I had to have another CT and PET scan. And it was the first time in 2.5 years that things were going down.
What, the tumor got smaller and
Little bit, and the SUV got a lot smaller, and it was they actually said mildly improved. I mean, every other time it was worse and worse, and it said mildly improved. I've been doing a lot of work though, a lot of, I've been taking supplements. Dr. William Lee talks about how we need to optimize our microbiome when we have cancer. So I'm doing a bunch of stuff, but I can promise you, Dr. Klaper, that whatever happens when I have a good outcome, Dr. Goldhammer will find a way to take credit for it.
We both know that, yes.
Yeah. That's that's the way it works with that.
Right.
Yeah. Oh boy. It's just so inspiring to see people that, have gotten long-term life, after a cancer diagnosis, regardless of what they've done, it's always happy to see that.
Hmm.
I was going to lose my hair with the first chemo treatments that I got in 2015. And so I was going to get it shaved. And I thought, well, let me see how it goes without getting it shaved. So I drank kale juice and green smoothies throughout the infusion. I kept drinking it as the infusion's going in. And I didn't lose any hair. I never lost hair. Never. It's wonderful. Yeah. That kale, I'll tell you. Love and kale, as AJ would say. Love and kale.
Yeah. That's amazing. Dr. Klaper, there's a question from Diane, and she wanted to know, how does fasting benefits apply to targeted therapy patients that is taken orally daily?
Similar to what Madeleine is doing now with her oral chemotherapy or her oral immunotherapy we're talking about.
I believe that's what the question
Right,
is. Yeah.
The immune system is like, the mathematical concept of fractals. You see these pictures that, the closer you look, the more it breaks up into smaller and smaller and smaller pieces. The immune system is similar. How do lymphocytes go about optimizing their ability to eat up cancer cells or put out antibodies against them? The more you look, the more mechanisms are involved and more enzymes and cofactors and permeability factors. And the closer you look, the more mechanisms you see. So when you ask, how does fasting do it? I could, over a glass of kale juice, I could speculate on, 10 different mechanisms, how it helps. But the key thing is the clinical outcome. Who's still alive, years later after taking the kale juice and the plant-based diets, etc. And I don't know how, those studies are being done on adenocarcinomas of the lung, etc. But in general, I suspect more and more studies are going to be showing that the patient's diet and constituents of the diet are really key factors in long-term survival. But as far as the exact mechanisms, assume it's working. The fact that we see this, Dr. Walter Longo's studies are showing clearly that the short fast has beneficial effects regarding immunotherapy treatment results. That's got to be enough at this point. Just look at the whole organism rather than tuning in on individual mechanisms. Madeleine, you look like you're going to say something.
No.
Dr. Klaper, we can get him on the show, and I think it's okay to talk about him because he's a friend. But you know Andres, right?
Yes, I do.
Well, that's another remarkable story of somebody who had cancer, and I believe it's 14 years for him.
Yes, 14 years.
So you must have seen some remarkable cases like this in your many years of practicing medicine. Maybe even if you can't say the people's name, maybe you can give some hope and talk about some of the encouraging things you've seen with people with any kind of cancer.
Yes, I've seen a couple of oral cancers that the surgeons wanted to remove half the man's face, as some of the surgery can be very disfiguring. And he had already had a large excisional biopsy where they took out the cancer. They got everything. There were clean margins. And he had changed his diet to a whole food plant-based one, was fasting, was doing everything great. And I said, hold tight, don't let him carve off half your face there. It's been 14 years. I'm still in touch with him, and nothing recurred. And I'm very glad that he didn't have the surgery. But clearly, if there were any residual cancer cells there, his immune system seemed to have dealt with it largely from how he was fostering good function of his immune system there. And another patient with a lung cancer, she could be Madeleine's cousin here, who has a nodule that they suspect is malignant, but it's just sitting there. It's been 10, 12 years now. Let's see, did she get any treatment? I don't think she had any treatment, or she may have had a short course of radiation therapy. I think they did zap it with with an electron beam. And it seems, and they still, you often find residual growth. Nothing. It's been 12 years now, and it's just sitting there. And as long as the cancer doesn't invade any either vital or a blood vessel or your brain or whatever, or encroach upon any pain sensitive, not encroaching on a nerve or anything, it doesn't really pose a great threat to you, and it's okay if they just sit there. As long as they're not growing, it's okay. And so again, you want to make peace with it, and again, that means getting your entire system one that promotes stability and normal function of your cells. And the modern diet does the opposite of that. And so you really want to go back. Gorillas in the wild have a very low incidence of native cancers, as far as I know. They don't generally develop them. And because they're eating a whole food plant-based diet, day after day. So, obey the laws of nature, and it reduces the risk of these malignancies growing.
Thank you. There's a question from Lois. It's not about cancer, but it's about a pneumothorax. And she says, what advice do you have? My pneumothorax came back. I have 3 tubes now.
Right. They do from time to time. Pneumothorax is air in the lung, in the chest cavity that collapses the lung. And it's often the result of something doctors have done as far as thoracotomies. When Madeleine used the term thoracotomy, tomo is to cut, thorax is the chest, so a thoracotomy is a cutting of the chest and to get at the tumor. But it can leave behind a deflated lung. It can leave behind a pneumothorax. They often put tubes in to reinflate the lung. But there is a condition called spontaneous pneumothorax, and it happens from time to time, and more common in women, usually taller women with longer rib cages. The lung from an early injury is maybe stuck to the side of the rib cage there, and if it tears away, it may put a leak in the lung, and air comes out, and the lung collapses. And sometimes, and it can be a recurrent spontaneous pneumothorax. And I had a patient had 3 times that she had to go to the hospital. They slipped a little tube and reinflated it. The chest surgeons can now, with their lasers, etc., they can cause little burns that stick the lung to the side of the chest wall, so to prevent it. But I would tell her, hang in there. Obviously, don't be a smoker. And put up with it for, if you have to get a total of 3 chest tubes, if you need a 4th one, then talk to a chest surgeon about a procedure to actually prevent these things from happening in the future. But 3 reinflations of pneumothorax, I think about 90+% of people don't have a 4th one, and so hang in there.
Thank you. Madeleine, how was the thoracic surgery? Because the last guest I had said he felt like when he woke up, he was literally run over by a truck.
Well, I woke up and I had some pain, but it was definitely tolerable. What happened was my arm, due to the back surgery, my arm was held up like this for about 9 hours or so. And as a result of that, I received some nerve damage and lost the power of my arm, which came back quickly. But it was one of the complications of the surgery. And the pain was not I don't remember it as excruciating. No, it's just a couple days with the chest tubes, and then I went home. So it was all good in terms of that. It was not a problem, not excruciating. So
You seem like you're a trooper, but maybe it's because you're a doctor that that you were able to handle all this better. What do you think?
I don't. I think so. I think many people can do this. Not because I'm a doctor, but you just got to have the courage and the discipline and keep looking. If you stop looking, like you're looking at ivermectin and so forth, and we have to continue to look, continue to pursue the alternatives, continue to pursue the conventional and so forth. So yeah.
Yeah.
Uh,
Oh,
yeah,
go ahead,
well,
Dr. Klaper.
as an old anesthetist, let me just mention if someone out there is facing an impending thoracotomy, if for some reason you're going to get your chest open there, um, talk to the surgeon, but ask to talk to the anesthesiologist and say, what can you do to minimize my post-op pain? There are things they can do as the surgeon is closing up. They can inject the wound edges with a long-acting anesthetic. They can put in catheters that they can inject bupivacaine or long-acting anesthetics for a few days and then pull the catheter out. There's ways, or they can put a little morphine in the cerebrospinal fluid in the thoracic vertebrae. There's things they can do to minimize post-operative pain. So again, be an active participant in your care and ask to talk to the anesthesiologist. The anesthesia folks love it when the patients talk to them preoperatively.
I would love to talk to an anesthesiologist, but you can't get an appointment with one unless you're actually booked for surgery. And Dr. Klaper, I knew you were an anesthesiologist because I remember the story you told about the time you had to take the blood yourself and you noticed what an unhealthy meal did. Because I see you now just as, this wonderful lifestyle medicine doctor. But that's why I didn't have the operation, is because I've had such bad experiences with general anesthesia. And I would love to talk to I have talked to anesthesiologists. They watch the show, and two of them, you know who you are. They're my buddies now, and I can ask them anything. But the one that would actually be doing the procedure, because I actually stopped breathing during general anesthesia and almost had to get on a ventilator, and I don't want it. That's why I've been avoiding the surgery. Not that I want it anyway.
Fair enough. Okay.
Yeah. If you were my anesthesiologist, Dr. Klaper, I would do it.
I'd love to talk to you about it. It'd
No,
be
I
very-
mean, if you would do it,
Yeah,
I would maybe
sure.
do.
Well, thank you.
But I'm hoping that this will just shrink it or do, I don't know what they call it, remission or no evidence of disease. As long as if this thing will just stay the size it is and doesn't metastasize anymore, I'm happy. I don't need
Indeed.
much more than that. I just need to get through the next 20 or 30 years or whatever and just, do that. I almost feel like everybody with cancer should get a medal. I'm meeting so many people that have it and that are, I have, had the success, Madeleine, but I mean, man, what you have to go through, it's crazy.
Yeah, a lot of journey.
Yeah.
Yeah.
How was chemo for you? Was that better than the surgery?
Chemo was tough because every time I went in for an infusion, and it was chemo, it was a carboplatinum, I was starting to get the neuropathy on my both feet. And that's really difficult. Your bottom of your feet are numb. And so your balance in life is thrown off completely in terms of walking and running and so forth. So that was the difficult one. And I still have the neuropathy. The neuropathy does not go away. For me, it didn't anyway. I still have it at my feet. And the hearing loss is visible, certainly, or understandable from the carboplatinum ×2. So, but again, they didn't listen. They didn't listen to the patient. And that was me. They didn't listen. I was having ear problems at that time, and they could have reduced the dose at that time, they told me, but they didn't. So that was a problem.
How do we get the doctors to listen, Dr. Klaper? It's like you just have to fight. And I've already said, please give me less.
Loudly in their ears, right?
Yeah.
AJ, are you having any other therapy besides the Keytruda?
No. None from my local institution, Sutter, just on my own, ivermectin and bendazole and, lots of supplements that were given to me by various people for optimizing a microbiome and taking things because Dr. Goldhammer said, you got to start sleeping more. Cause I've always been a bit of a workaholic, and especially since being diagnosed with cancer, I've thrown myself into my work. And now they have me on melatonin and, magnesium. And I I go out like a light every night, and I sleep till 7 o'clock now instead of 4:30, which was my usual wake up time. So
Wow, that's wonderful. That's a great thing. That's a healing force in
yeah,
itself.
no, I never really thought about sleep as I figured the less the better, get more done. But no, I've changed completely how I do that kind of thing. Yeah, but Madeline, did you go in any support groups while you were going through cancer treatment? Because I find those enormously helpful. Sometimes they can be sad, but sometimes they can be really helpful.
Yes, absolutely helpful. Yes.
Yeah.
Mhm.
Yeah. Well, cool. So let's see. Do you guys have any more questions for Dr. Klaper before we let him go? And it's such a treat to have him here.
You look good, AJ. You look
Oh,
great.
thank you. Yeah. Thank you so much. Did,
Both
did,
of
did,
you.
did you have radiation, Madeline?
No, I did not. I was offered radiation, and then I got a second opinion, and that particular oncologist said he was an agnostic. He didn't think I needed it, so I didn't do it. I didn't do it. Although some recommended it, yes, but I didn't do it. But I have to tell you one thing that cheered me up during this process too is I remember you in stand-up comedy, Johnny Carson, that you played that for us when we were in True North. And when I got home, I took a stand-up comedy course, and it was wonderful. It's just wonderful. And I did performances in hotels and all of that stuff. It was so fun. But you've got to have fun. You just got to have fun along the way here. So
That's what I'm trying to do, Dr. Clapper, make cancer fun. And I am been doing tons of comedy. And now that I know this about you, Madeline, I'm going to invite you to take my comedy class with me because that is just the best thing of all. Dr. Clapper, there's a viewer that's asking about exercising during fasting or intermittent fasting.
Be gentle with it. Don't lay in bed for days on a fast. You got to get up and move, and some general stretching, a little yoga is okay. Walk around the block, but don't go out for a 2 mile run. Your blood sugar is going to drop, and you're already in a state of stress there from the fast. So gentle activity only during the fasting time, and again, stretching, yoga, and walking. Hold it at that.
Yeah. I will say there's one good thing about going through cancer treatment, though, as I was told I am not allowed to go to the dentist and even get my teeth cleaned. And I'm like, cool, because that's like my least favorite thing. One of the viewers is saying if either of you have advice for me today as I start my cancer treatment at 3 o'clock.
Madeline, you have
I'm
any
sorry.
advice?
I'm
Yeah.
sorry. What? Say that again.
Do you have any advice for me as I start my cancer treatment today?
Um, started today. Just be you, and you just have to relax into it. That's all. It's a short infusion, Keytruda, as I remember. Maybe just an hour, I think, or maybe an hour and a half. But
No,
that's
it's my understanding is it's 35 minutes.
oh, good. It's better than
They keep you a little longer the first time, though.
yeah, yeah.
Oh,
So yeah, I mean, you're there. You're positive. You're on some alternatives. You're doing conventional. You're doing all you possibly can, and I think that's what you have to do. Just keep on going, learning what I did, what somebody else did, and that'll bring you to conclusion, I think.
absolutely. Thank you. Dr. Clapper, what advice do you have for me?
Um, I feel very positive about this treatment for you, and so should you. And if on any level there's any resistance, drop it. Welcome this agent into your body. Don't resist it. Welcome it. It's a brick in the wall there that you need placed. Along with all the other good bricks that you're doing with your diet and your lifestyle and your sleep, etc. This is going to complete my healing, and just see that tumor just shrinking on down and melting away, and put as most positive visualization around it as you can. And when you come off your fast there, jump on, you go to AJ food there. Have a big salad and some some steamed greens, and off you go. You're just great. I have really
Oh,
good feelings about you.
oh, thank you, Dr. K. Hey, here's a question from Mark. Can Dr. K explain how juicing can help cure cancer when sugar feeds off cancer?
Well, I
Or
don't know if
cancer
I'm
feeds off sugar, sorry.
right. Well, I'm at no time I've ever said that juicing can cure cancer. I don't use those terms. Could juicing be beneficial? It could, I suppose. Um, just a couple things about juices. One, you obviously, there's juices and there's juices, just like there's cancers and cancers. You don't want to be drinking fruit juices. You want to avoid a big glug of fructose sloshing through your cells. These are green juices we're talking about. There's juice, kale and spinach and chard, etc. You can put a little apple in there so it doesn't taste like lawn clippings. But these are basically green juices, uh, and uh, and I'm favored not to chug-a-lug these things in 30 seconds here. This is potent nutrient therapy here. So take a mouthful, put the glass down, chew it up, mix with your saliva, swallow it. Wait 15 minutes, wait a half hour, let it get down into your tummy, out in your system there, then take another mouthful. We're talking about a 6-ounce glass here. We're not talking about 24 ounces of green juices here.
Very good.
And drink it slowly. And if so, it can help. I don't know of any double-blind placebo-controlled studies on juices and particular cancers. But as my Swedish grandmother would say, it couldn't hurt.
Oh no. So 6 ounces, I mean, I had 24 and 32 yesterday, so that was 36.
Great.
That was for the whole day,
The
not
whole
even.
day, fair
Yeah,
enough.
yeah,
That's,
okay.
that's reasonable for the whole day, but don't chug the lugs 24 ounces at one time there.
Yeah. Yeah, yeah. And mine is mostly green, just tiniest bit of apple to make it slightly palatable. But I can do it without the fruit. It's just that my husband has
Yeah,
been supporting me in juicing, and so he needs a little bit of apple to get it down, you know? All
absolutely.
right. Last question for each of you, and I'll let you go. What message of hope would you give to somebody currently facing a cancer diagnosis?
Michael, you go ahead.
I'm
If you are alive, there is hope. And your body responds to your thoughts, your activity, your emotions. Get it as positive as you can. Nobody's getting out of here alive. We all have a limited amount of time on this planet. The art and the goal is to make every day as filled with love and laughter and learning and good deeds for people as you possibly can. That's how you win the game here, no matter how many days of those you have in your life uh, chart written down here. And the very act of living life, being fully present. Even I'm getting immunotherapy now. Whatever it is, that's what's happening in your life. Enjoy it. Be fully present. Thank heavens for it. Be grateful with a capital G that we're here at all. 99.9% of the mass in the universe is dumb old hydrogen gas in the middle of stars. The fact that we are here in these amazing bodies with DNA and enzymes and a heart and soul and ability to experience this amazing life, be fully present with the miracle. And your cancer diagnosis is one of those. I've had more than a few patients over my career say, Doc, may sound crazy, but getting this cancer diagnosis is one of the best things that ever happened to me. It made me look at my life. It made me stop doing things that waste my time, my energy. I got out of a bad relationship. I quit a job that I hate. I'm doing what I love. It made me move along in my life in a way that I clearly needed. So I wouldn't wish it on anybody, but if it's come into your life, well, there's a message there, and there's energy to be used and channeled in as positive a direction for however many days each of us have on this planet. So the mortality rate in this room is 100%, and
even for vegans.
even for you, for all of us. So enjoy your cancer diet. That may sound blasphemous. I don't want to be too
No,
insensitive, but
no,
it's
no. I listen.
very
I love joking about it. I mean, I nothing that makes me happier when somebody says, "How you doing?" I go, "I got cancer. How do you
yeah.
think I'm doing?" You know.
You really want to know? Exactly. Be careful what you ask for.
Yeah.
So,
So,
so
are you able to see patients virtually again?
yes, Yes, I can see patients virtually and go to my website, drklaper.com, and you'll see how to get in touch with me for speaking engagements, etc. And the last one is request a medical consultation. So we can help arrange that for you. Right.
Fabulous. I'll make sure to put it in the show notes. And you're part of the McDougall program now, aren't you? At least,
I teach for them on a regular basis.
yeah,
Great
that's
to have you.
fabulous. That's fabulous. Well, I'll see you there. Well, thank you so much, Dr. Clapper and
You're so
Madeleine.
welcome.
Congratulations on your success.
Great. You both look great. I'm so
Thank you, thank you, thank you.
Thank you so much. And thanks all of you for watching Chef AJ and Friends. Please come back Tuesday at 11 a.m. Pacific time for Heather McDougall, the CEO of the McDougall program, and Dr. Anthony Lim, along with a few of their success stories. And they're going to show you how you can transform your life and lose weight with the McDougall program. And if you take it, you'll be able to hang out with Dr. Clapper. Take care, everybody.